You used to have energy, clear skin, and a sharp mind. You slept well, your mood was stable, and you felt like yourself. But now you're exhausted. Your brain feels foggy, hot flashes wake you up at night, and your body doesn't feel like your own anymore. What changed? Estrogen. You see, estrogen affects over 400 functions in your body, from your brain to your bones to your heart. So, when it declines and eventually disappears during menopause, everything shifts. Today, we are covering about what estrogen does and what happens when it fluctuates and declines and what you can do to protect your health. Hi, I am Dr. Indrani Raman. Stay with me till the end. I also have great tips for you. Estrogen isn't just one hormone, it's actually three different types that are in our body. Estradiol, which is E2, this is the main estrogen type that we have during our reproductive years, the most potent, but that's what we'll focus on today. Estrone is E1 type, which becomes dominant after menopause. It's weaker than estradiol, but is produced in fat tissues. Estriol, the E3, is the weakest type of estrogen, primarily produced during pregnancy. So, when I say estrogen today, I'm talking about estradiol, the one that declines during perimenopause and totally disappears in menopause. So, what does estradiol do for us? So, it keeps our brain sharp with good memory, focus, and mood. It protects the heart and blood vessels, maintains bone density, keeps that skin elastic and hydrated, supports vaginal and bladder health, regulates body temperature and metabolism, and supports healthy cholesterol levels. So, when estrogen changes, we feel it everywhere. So, perimenopause typically starts in our 40s and can last 4 to 10 years. During this phase, estrogen doesn't just decline, it just fluctuates wildly. That means one month it's high, the next month it's low. Here is what this makes this phase confusing. Even though estrogen is declining overall, you can experience what's called estrogen dominance because progesterone declines first and faster, creating that imbalance. These are some of the symptoms people can have when they have estrogen dominance, which can be heavy, prolonged periods or flooding, breast tenderness, fibrocystic breast, mood swings, irritability, weight gain around hips and thighs, bloating, and water retention. They can even have worsening migraines. So, as you move through perimenopause, estrogen drops more significantly, bringing on that low estrogen symptoms, which are hot flashes, night sweats. We're all familiar with that. Sleep disturbances, vaginal dryness, painful intercourse, brain fog, memory issues, anxiety, and depression, and even dry skin and thinning hair. This is why perimenopause is so challenging because you're dealing with both estrogen dominance and deficiencies because of fluctuating levels, sometimes simultaneously. Here is what matters. How your body breaks down and eliminating estrogen is important because your liver process it and your gut eliminates it. If these systems are not working well, estrogen gets reabsorbed. That can worsen the dominant symptoms. There are good metabolites like 2-hydroxyestrogen that are protective, and there are bad metabolites like 16-hydroxyestrogen that can increase inflammation and disease risk. Supporting liver and gut health helps create more good metabolites and eliminate the bad ones. So at menopause, right, 12 months without a period, your ovaries stop producing estradiol. Your body shifts to producing mostly estrone from fat tissues. But it's not enough to support the functions that estradiol used to handle. Here are the most common symptoms a lot of women experience with that low estrogen levels. Hot flashes and night sweats. Up to 80% women experience this because estrogen has a tremendous role in temperature regulation. Vaginal dryness and atrophy. The tissues become thin, less elastic, less lubrication, and painful sex, and more risk for UTIs. Sleep disturbances. Estrogen affects serotonin and melatonin production. Brain fog, memory issues, because estrogen supports the neurotransmitters, the brain chemicals, dopamine and serotonin, and blood flow to the brain. Mood changes, increased anxiety, depression, irritability, because estrogen is also affecting your dopamine and your GABA levels. Last but not least, weight gain and metabolic changes, especially belly fat, as estrogen regulates insulin sensitivity and fat distribution. Here is one more important thing most people don't realize because estrogen has anti inflammatory effects. Without it, inflammation increases. That means more joint pains and stiffness. There are a lot of long term health risks without estrogen: osteoporosis, Women can lose up to 20% of bone density in the first 5 to 7 years post menopause, dramatically increasing their fracture risk. Cardiovascular disease becomes the number one cause of death in women after menopause. Cognitive decline because increased risk of dementia and Alzheimer's, particularly if estrogen loss happens before age 45. Replacing estrogen is not just about feeling better, it's about protecting your long term health. I do want to bust some myths here while we're talking about estrogen. Myth number one, estrogen causes breast cancer. The truth, bioidentical estrogen balanced with progesterone and started early in menopause does not significantly increase breast cancer risk. The increased risk in older studies was linked to synthetic hormones, not bioidentical estrogen. Myth number two, you don't need estrogen after menopause. Truth, without it, your risk for osteoporosis, heart disease, dementia, and debilitating symptoms increases dramatically. Myth number three, phytoestrogens like soy are dangerous. Truth, these weak plant compounds actually help balance estrogen levels and may be protective. They are not the same as your body's estrogens, but it's important they are not GMO and they are organic. Myth number four, estrogen makes you gain weight. The truth, it's the loss of estrogen that causes weight gain. Replacing it can actually help with weight management. Bioidentical estrogen replacement therapy is the answer for a lot of those questions and the symptoms that I stated above. But it's important that it's bioidentical because this is molecularly identical to what our body makes. It is safer, more effective than synthetic estrogens like Premarin, which is derived from a pregnant horse urine. You can take it in many forms: patches, pills, creams, gels, and benefits, and pellets. The benefits of hormone therapy is eliminating or dramatically reducing your hot flashes. Of course, improvement of that vaginal health, less urine infection, improvement of bone density, less osteoporosis, reduce cardiovascular risk, and of course, improved quality of life overall with the sleep, mood, energy, and all of this. There are some risks which are minimal, though, when used. They need to be, of course, customized for each person and they have to be used appropriately with monitoring of the levels. So, working with a knowledgeable provider or a doctor who understands bioidentical hormone therapy is important. Your family history may be different, your own past medical history may be different. So, any woman going through menopause symptoms or going through osteoporosis, cognitive decline, starting within the first 10 years of menopause provides the greatest benefits. If you have a uterus, you got to take progesterone with estrogen to protect your uterine lining. While hormone therapy is most effective, there are some natural approaches that can help to increase our, process estrogen better. One is supporting liver and gut health. Eat cruciferous vegetables, broccoli, cauliflower, Brussels sprouts to metabolize that estrogen properly. Reduce stress. Chronic stress raises cortisol, which suppresses estrogen production. Eating more phytoestrogen rich foods like flax seeds, sesame seeds, organic soy, they provide gentle estrogen like benefits during menopause. These help, but they don't replace what's missing once you reach menopause. So, if you're already going through all of those symptoms that I mentioned above, your estrogen levels being low are likely that reason. So, talk to your doctor about bioidentical estrogen therapy. Ask specifically about bioidentical hormones, not synthetic. And if you don't get help with your current doctor, do find one who has trained in the hormone therapy because you need to advocate for your own health. And for personalized support so that you can help understanding your symptoms and navigating the testing part, creating a plan for you. Schedule a free discovery call with my team. We work with thousands of women going through menopause and help them transform their life. Listen, estrogen affects your brain, your heart, bones, mood, and sleep. When it declines, you feel it everywhere. But you don't have to suffer. The estrogen therapy can help you reclaim all of those symptoms and also improve that quality of life. Thanks for watching. Give this a thumbs up and subscribe for more hormone health content and share with a friend who might be going through symptoms similar to you.